This is Larry Bauer with the Family Medicine Education Consortium, and I have the privilege today of interviewing Dr. Nick Turkal, who's a family physician, who is a health system leader, and I'm going to let him tell you about his work in Wisconsin. Dr. Turkal, thank you very much for joining with us.
Thank you. It's a pleasure to be with you, and we're talking about a topic that is near and dear to my heart, and that's about how family physicians are really leading the healthcare transformation in this country.
Fantastic. Thank you. So could you tell us some background about yourself? Where did you go to medical school, residency, and what happened in your early years after residency?
Sure. I'm happy to share a little bit of that. I went to Creighton University in Omaha, Nebraska. I finished medical school in the early 80s and then did my family medicine residency here in Wisconsin. And at the time, Milwaukee was a very good place, and I hope it still is, for family medicine education. Family physicians provide a lot of the care in Wisconsin and surrounding areas. So I had a wonderful residency training in Milwaukee. I then went to a small community in central Illinois where I practiced for several years. And that was a phenomenal and eye-opening experience. What I learned about a year into practice is that much of what I had learned in medical school and what patients told me they needed from us as healthcare providers, there was a gap that needed to be bridged. We were all taught in fairly traditional ways in medical school, and then chose to enter a profession like family medicine that is happy to deal with some uncertainties. And patients deal with uncertainties all the time about access, about how to get the best care, about what they know or don't know. So I was very much struck by this gap in what patients and communities needed and how we were trained. And that launched my interest in systems thinking and how we design better systems of care so that patients can access us more easily. And from there, I can keep talking or you can ask some questions, but I got very interested in how we lead change in healthcare.
So what did you do with that? How did you grow yourself as a leader?
My leadership journey in healthcare probably started a little bit during residency when I ended up as chief resident at a time when we were going through a residency director change, and I learned a lot about leadership of people and physicians and sort of marshaling resources. So as I found myself in this small community asking how are we going to lead some change here, I found it really interesting to try to apply some of those leadership skills and say, I might be a new practitioner here, but what could I do to change care in this community? So I began to connect this small town in Illinois with referral centers in Springfield and Champaign and Indianapolis, but with a bit of a twist in that we were asking, often for the first time, for specialists to come out to our communities to make it easier for patients. And then we paired that with some technology, like at that time thrombolytics were fairly new in cardiac care, and instituted a program in this small community hospital for that. So I began really by leading in that community, and a couple of years later decided to make a change and actually came back to Milwaukee.
And could you describe sort of your path, your leadership path, the one step that led to the next?
Yes. When I came back to Milwaukee, I worked on the faculty at University of Wisconsin Medical School for a number of years, but I was always here in our Milwaukee clinical campus. And so we were fairly well integrated with Aurora Healthcare, the system that I now lead. And a couple of things happened. My research interests back then were in this evolving area of population health, and I had this wonderful population of 1 million patients that Aurora takes care of. So I was interested in how we get further on that. About the same time, they had asked me to be the medical director of one of the clinics. And what I shared with folks at the time is I know some intuitive things perhaps about leadership, but I'm not really well trained or perhaps appropriate to be a medical director. So I started back getting some education. And understand this is back in the late 1980s, before it was perhaps popular for docs to get MBAs. So I worked with the American College of Physician Executives in a number of their courses, and later on went to Northwestern at Kellogg for some of my financial training, but really tried to get courses as I needed them that I could apply to leading. And so I led the clinic that I was in for a period of time. Then I was a residency director. And after that, I spent a good amount of time developing the quality initiatives and quality measurement system at Aurora, the care management program. And from there, led our Milwaukee area system, and from there became the CEO of Aurora about 10 years ago. So it was a very gradual and natural progression for me. But I have to say along the way, I had mentors and leaders and people who were willing to take a chance and give me additional responsibilities, often before I thought I was ready for it. And I'm very thankful to those people. And I think often they did that because I used the same skills that I brought to the exam room as a family doctor to what I do in leadership. And that is a pretty common sense approach to looking at data and developing relationships and using that mix to get to good solutions.
Can you comment, do you still see patients?
I do, and I have a very small clinical practice now that I have shared with a family nurse practitioner for the last 15 years. She's present there every day, and I am there part-time, very part-time, where I'll spend a half day now and then seeing patients. Many of the patients I'm seeing now are second or third generations of families from when I first came to Milwaukee. They understand my job, and they're very appreciative that I still continue to come to the office, even though they know I have a full-time administrative job. But it's an important part for me of knowing what our doctors are going through, but more important, keeping me grounded in the reason that I went into medicine and the reason that I chose to follow a leadership path, and that is to make things better for the patients we take care of. So it's incredibly important. I've limited my practice to outpatient, and it's primarily now geriatrics as my patients are aging with me. But it is so rewarding and so wonderful, and it is a great opportunity in family medicine to be able to lead but still do some clinical work, and I found it just so rewarding.
So could you comment on, from your perspective, what's the value of having a family physician in a health system leadership role?
I hope, and what I've tried to role model through the years, is that the same reasons that I chose family medicine are the reasons that I hope I'm a good health system leader, and that is a broad understanding of what goes on in healthcare and what our patients experience, an acceptance in family medicine that I don't have to have extraordinarily deep knowledge in any one area. My job is to connect our patients to that. Same thing in an administrative role. I've always been comfortable saying, I may not have an answer to something, but we're going to gather the right people or specialists together to find an answer. That approach has been absolutely critically valuable to me as a clinician and as a health system leader to say, we're going to figure out an answer to this. And the exciting part now, as healthcare is going through this great transformation, the story hasn't been written. We have a chance to write the story of how healthcare emerges, and I don't think there's anyone better prepared than family physicians to help write that story and transform healthcare in today's world.
So could you comment on this? It may be surprising for some folks that these various subspecialists did they respond to you as a health system leader? Are there any concerns that they have about having a generalist like a family physician in a leadership role?
You know, I think our specialists across the system respect that in the same way that they respect patients being referred from me in the past or currently. They understand that I absolutely value their specialty skills. I think we've done a nice job here at Aurora of not having a specialist versus primary care attitude. We have about 1,800 employed physicians, about half specialty and half primary care, and they work as a wonderful, large, integrated system. But I think a lot of it is the respect that they show to each other for what they know. And I hope in some way that my leadership style has been part of that's helped to foster that respect and make sure that our physicians know, for example, that Aurora Healthcare is not a hospital system and it's not a physician system, it's a healthcare system. So we have 15 hospitals, we have a psychiatric hospital, we have 1,800 doctors, a home care organization, pharmacies, and lab. Those are all parts of a healthcare organization. And I think for physicians to feel that they are part of that leadership and part of setting the direction is incredibly important.
Do you have any recommendations for students, residents, young practitioners who might be thinking about health system leadership throughout the course of their career?
Absolutely. I have a couple of beliefs, and understandably based on my experience, but I think they apply pretty well. First of all, family physicians who end up in leadership roles for the right reasons do an incredibly good job. And that would mean that they're good, solid practitioners. They're really good with patients. They're not trying to get away from clinical care, but augment what they do in it. So first and foremost, being a great family doctor is just great training to be a leader in so many different areas in healthcare. The second thing would be if we could do one thing better in healthcare, it would be to truly listen to our patients. And I think as family doctors in the exam room, we do a very good job of that. Sometimes when doctors get into leadership roles, they forget to apply those same simple skills of being a good listener, don't have to know everything, gather the right information and make a good decision. So the second thing would be use your skills that you already have to be a good leader. Third thing would be selectively augment those skills. Don't be afraid to say what you don't know, and then go out and get educated on that, either through practical experience or formal educational approaches. There are so many good educational approaches available for physicians. And then perhaps the last thing is when you learn things about the administrative world or leadership in healthcare, be sure to apply them just at the micro and the macro level. Sometimes I worry that physicians think leadership is somehow elevated to a different level and you're making big decisions. In fact, in your own environment as a family doctor, if you're only seeing patients, you can be a tremendous leader in that clinical environment and help to change that. If you can change your own environment around you, you can change larger environments much more easily. So apply those leadership skills to whatever local environment you're in and do it regularly. And I think the last piece of advice that I would give to anyone, regardless of leadership or not, is take care of yourself. Have a balance in your life, because without the right sort of balance, you won't be able to run this marathon of a career of being a physician and hang on to your health and all the things that go with it.
I think that's very sage advice. Thank you very much.
You bet.
So I've been speaking with Dr. Nick Turkal, who is the Chief Executive Officer of the Aurora Health Care Organization in Milwaukee, Wisconsin. Thank you very much, Dr. Turkal, and I've enjoyed the chance to chat with you.
Thank you, Larry. Appreciate it.